What we're being challenged in healthcare now is to deliver true value, which means provide quality for the amount of money spent. In certain areas, particularly in hand surgery, we're now seeing the migration of surgical cases from outpatient to office procedural suite. It is safe, effective, cheap, and by definition truly provides value for patients, reduces the cost of healthcare dramatically. In the one series that we looked at in a year, one surgeon can save over $1 million in healthcare costs. There are few patients, because of their comorbidities, have to have the surgery done at the hospital, or historically have had to have it done at the hospital. We no longer look at any of that as a factor, and we've shown in our series that we can do this very safely, very effectively, with low complication rate, even in patients with significant comorbidities. In our series, we looked at about 300 patients from age 16 to 91. We had patients on blood thinners, we had patients on oxygen, we had patients who were told they should never undergo an anesthetic again and learn to live with their painful hand or trigger finger. And we performed the surgery in the office, very simple, very safe, very effective, and very pleasing for us to see patients have a good outcome, whereas they had learned to live with this pain or discomfort prior to it. We're seeing a lot of benefits to doing this, not just it's cheaper, but it really does provide value for patients. And we have recently seen the migration of patients coming in from employers that are self-insured, that want their patients to receive this type of care at Spectrum Health because it's cheaper, and we can work with them on getting the patient back to work quicker, which of course reduces their costs. Good. About 90% done. How's that? I should say, but don't blink. Another aspect that's frequently not talked about is the amount of equipment that we use to perform the procedures. So the number of drapes, the number of plastic bowls and suture and so on. Our environmental impact is substantially lower when we do surgical procedures in the office setting compared to the ASC or even in the operating room, and that is immeasurable.